What is the link between sleep, dementia, and mental health? Dementia affects 1 in 14 people over the age of 65 and 1 in 6 people over the age of 80. And although we may think of dementia as something which affects people in the later years of life, younger people can be affected by dementia too. There are many forms of dementia, but the most common include Alzheimer's disease, vascular dementia, Lewy body dementia, REM behaviour disorder, and Parkinson's disease. Some forms of dementia are caused by a build-up of proteins in the brain. These proteins are called amyloid plaques and tau proteins. When amyloid plaques and tau proteins damage brain cells, it can cause symptoms like loss of memory and concentration, loss of control over movement, and difficulties with managing emotions and communication. It was once thought that dementia caused poor sleep, but an increasing number of studies show that poor quality sleep and the symptoms of mental ill health, like depression, are risk factors which can start years before dementia symptoms appear. One long-term study found that if we don't get enough sleep during our 50s, 60s, and 70s, the risk of dementia increases by as much as 30%. This is because the loss of sleep over a period of time can result in rising levels of amyloid plaques. As we enter the later stages of our life, we are likely to spend less time sleeping overall. But throughout our lives, we need the right balance of 2 different kinds of sleep. These are deep sleep and REM or REM sleep. We need deep sleep to repair and replace the body's cells, especially when we are young and the body is still growing. It is during deep sleep that the amyloid plaques and tau proteins, which build up in and around brain cells, are cleaned up. So deep sleep helps to protect us against dementia. REM stands for rapid eye movement. We need REM sleep, when most of our dreaming happens, to calm our brains down by metaphorically acting out unresolved concerns from the previous day. During REM sleep, cortisol stress hormones are reduced. If cortisol stress hormones are not reduced, they cause the build-up of amyloid plaques and tau proteins, which damage brain cells. So, REM sleep also protects us against dementia. However, there are a number of barriers to getting the right balance of deep sleep and REM sleep, which can increase the risk of dementia in later life. Insomnia and daytime sleepiness often occur alongside dementia. These can increase the risk of accidents and injuries from falls, slips, and trips. But if insomnia occurs earlier on in life and continues over time, it can stop us from getting enough REM sleep to clear away the cortisol stress hormones which cause the amyloid plaques and tau proteins. This is why insomnia in earlier life is a risk factor for depression. About 30 to 50% of people with dementia, or 1 or 2 out of every 3 people, will also experience depression. This might be because the symptoms of dementia can be barriers to meeting the emotional needs upon which mental health and well-being depends. For example, the loss of memory and concentration can prevent a person from feeling safe and in control of their lives, especially if they lose their independence and have to rely upon others. Difficulties with movement can prevent a person from meeting emotional needs for control, but also the sense of achievement if they can no longer participate in physical activity. If a person is affected by the loss of memory and concentration, they may also struggle to give attention to other people or to remember shared emotional connections with loved ones and friends. Given that dementia can prevent people from meeting their emotional needs, it should come as no surprise that dementia can give rise to the symptoms of mental ill health. But, like insomnia, depression in earlier life can also increase the risk of developing dementia later on. Depression, arising in response to stress and worrying about unmet emotional needs, causes an increase in REM sleep in an attempt to calm us down and clean up cortisol stress hormones. But as well as causing people to wake up feeling exhausted and low in mood the next day, the increase in REM sleep also stops people getting enough deep sleep to repair brain cells and to clean up the amyloid plaques and tau proteins which cause dementia. Another risk factor for dementia associated with depression is the long-term use of antidepressants. This is because antidepressants act by reducing the excess REM sleep seen in depression. While this gives the person a break from the exhausting amount of dreaming which comes from depression, it also stops REM sleep from doing the job of clearing away cortisol stress hormones. The buildup of cortisol then contributes to the rising levels of amyloid plaques and tau proteins. One 12-year study of the effects of long-term antidepressant use found that for every 1% loss of REM sleep, there is a 9% increase in the risk of developing dementia in later life. So what can we do to prevent poor quality sleep, insomnia, and depression from increasing the risk of dementia? The answer lies in addressing the stress caused by unmet emotional needs. We all need to learn relaxation exercises to reduce stress. This can help to stop the excessive worrying, which causes an increase in REM sleep. When we are calmer, we are in a better place to plan how we might start to meet our emotional needs in healthy ways. Ask your GP about social prescribing and ways to better meet your emotional needs, or look at the Suffolk Mind website. Finally, seek advice on how you can protect your mental health by improving the quality of your sleep.